Federation, in case you didn't know it, we are the largest Jewish philanthropy in the state of New Jersey, and through our agencies we provide a network of services, support services for thousands of vulnerable Americans, many of them elderly and disabled. The Trump administration wants to transform Medicaid into a block grant, essentially capping the federal share of funding, which the Jewish Federations of North America opposes. What type of funding or legislation do you support?
I oppose turning it into a block grant. I have been throughout this district. I've been to the Eric Johnson House in Morristown, where people living with HIV make their home. I've been to the Preakness Health Center in Passaic County, where some of our most vulnerable citizens are helped through assisted living. I've held disability roundtables to hear from the providers and the parents of disabled youth about the challenges that they face. And I've also heard from many families whose parents rely on Medicaid for long-term care. So this is something that we've got to protect. I don't believe in cuts to it. I certainly don't believe in block grant funding for it, which will result in cuts to Medicaid.
Thank you.
Medicaid is a vitally important program. It is a part of our safety net that should remain. That doesn't say it couldn't use reform. I think the best reform we can have for Medicaid is to make less people who need Medicaid. And so since the tax cut of 2017, we've seen 1.5 million fewer Medicaid participants because they've gotten jobs and the economy is stronger and they are now getting health insurance, not through the government. So that's the best reform to Medicaid. The best social program we know in this country is a job. There are other things we can do to improve Medicaid. I've been active on the state level trying to get more specialists to participate in Medicaid and take those lower reimbursement rates by doing things like often suggesting that we don't tax the revenue that doctors make from Medicaid patients. Why would we subsidize and pay doctors to treat Medicaid patients and then with one hand and then with the other hand go and tax the very money that they just earned by treating Medicaid patients? Let's let them earn the dollars they earn, or let's let them keep the dollars they earn from treating Medicaid patients tax-free. How about let's cap non-economic damages in medical malpractice suits for those doctors who give a substantial part of their practice to Medicaid patients. That would encourage doctors to treat more Medicaid patients and open up more specialists to those on Medicaid. These are all things we can do at the federal level. I've tried to do them at the state level, and it would improve the service and the system for them. As far as block grants go, I don't think we should close our minds to that. Block grants can be and have been welcomed across the country in some states as an opportunity to innovate and control costs and try new programs. A block grant in a state could, for example, aggressively treat and prevent chronic illnesses, which cause so much of the medical spend in our nation. So as a tool for innovation and as an idea to streamline the program, I would not categorically rule out block grants for Medicaid.